Welcome to The Explainer. Look, today we're tackling a topic that, frankly, brings up a ton of anxiety for a lot of us. But we're going to demystify breast cancer symptoms by looking strictly at the facts. We're going to use clear, straightforward medical vocabulary to essentially replace that fear with actual knowledge. Let's get right into it. Here's our roadmap for today. First up, the invisible truth. Second, decoding breast lumps. Third, skin and nipple changes. Fourth, the truth about pain. Fifth, beyond the breast. And finally, why you really shouldn't be an ostrich. Section 1, the invisible truth. Okay, so this is the exact question so many people furiously type into search engines at 2 in the morning. I have this symptom, could it be breast cancer? And hey, it is a completely valid thing to wonder about. That's exactly why we're systematically going through the things people actually notice before a diagnosis. But before we look at what you can see or feel, we got to talk about what you can't. Here's the crucial point to understand right off the bat, and honestly, this is a huge one. Most breast cancer presents with absolutely no symptoms at all. None. It's usually detected through screening mammograms or, for those at very high-risk MRIs, way before any physical symptoms even have a chance to appear. Routine screening is, without a doubt, your absolute strongest frontline defense.
All right, Section 2, decoding breast lumps.
So when we look at the actual geography of the breast, the upper outer quadrant is the most common area where cancer abnormalities tend to pop up. Think of that as the section closest to your armpit. But remember, they can happen absolutely anywhere, on either side. It's really important you learn this clinical vocabulary. Why? Because it empowers you to confidently read your own medical portal records and actually understand what your care team is looking at. Let's bust a major myth right here and now. There is no such thing as a single safe profile for a lump. They can be large, they can be tiny, they can feel completely smooth or really irregular. Painful, painless, you name it. The takeaway, every single mass deserves attention from a medical provider. And yes, this applies regardless of your age. Even if you're under 18 and breast cancer is incredibly unlikely, other things like lymphomas can still occur. Get it checked out. Now, our source provides this super practical 3-step method to check if a lump is movable or fixed. Basically, you put one hand on one side of the breast, press on the other side, and just see if the mass moves while keeping a finger on top of it. Some lumps are going to move super easily, like a little marble. Others are incredibly hard to move. But listen, whether it rolls around easily or feels like it's firmly planted in the tissue, it requires a professional evaluation. Period. Moving on to Section 3, skin and nipple changes. You might actually see the term retracted nipple pop up in your medical records. This is basically just the clinical term for a nipple that is suddenly pulled back or maybe changes direction, like pointing up or down instead of matching the other side. But beyond just the nipple, you should also be visually inspecting the skin itself. You're looking for skin that appears pulled back, puckered, or maybe dimpled. A pro tip? This is often way easier to spot if you raise your arms in front of a mirror. Also, just keep an eye out for any unusual scaling or dryness. Another really key surface symptom is discharge, and here, making a comparison is absolutely vital. Noting whether a symptom is happening on just one side versus both sides, that is a massive clue for your medical team. Discharge on both sides is usually just tied to hormonal changes, things like pregnancy or your period. But discharge, whether it's clear or bloody, that happens on only one side, that is significantly more concerning and absolutely warrants a visit to your provider. And hey, the exact same rule applies to skin peeling. If it's persistent and it's just on one side, please get it looked at. Section 4, the truth about pain. The core message I want to get across here is pretty stark. Pain is simply not a reliable marker. Breast cancer can be painful, or it can be entirely 100% painless. A lot of people mistakenly assume that if a lump hurts, well, it must just be an infection, right? Or conversely, they think if a lump is completely painless, it's totally safe. Neither of those assumptions is medically accurate. A painless mass can be cancer, and a painful mass can also be cancer. So please, whatever you do, do not use pain as your own personal diagnostic tool. All right, Section 5, beyond the breast. So, even if your breast itself feels completely, totally normal, discovering a lump in the adjacent lymph nodes is a vital signal that you need to get checked out. We have lymph nodes located right under our arms, in the armpit, and also just above the collarbone on either side. Now, a swelling in these areas could absolutely just be a standard infection, but ruling out breast cancer as the underlying cause is a necessary, non-negotiable step.
We also really need to talk about what happens when cancer actually goes beyond those local lymph nodes. When breast cancer is advanced and spreads elsewhere in the body, there are these rapid-fire systemic symptoms that can start to manifest. We're talking extreme fatigue, completely new bone pain that you've just never felt before, nausea, vomiting, and jaundice. And yes, I know these symptoms overlap with a ton of other conditions, but in the context of your breast health, they are critical signals we cannot ignore.
Which brings us to Section 6, Don't Be an Ostrich. I love this quote from our source material because it just perfectly captures human nature. Don't be an ostrich. Don't put your head in the sand. Look, it is incredibly normal to feel terrified when you find a lump or notice some strange skin dimple. It's scary. Many of us just want to ignore it and pray it vanishes on its own. But the reality is, the sooner something is caught, the vastly better the outcome. Whether you go see your primary doctor, a nurse practitioner, a gynecologist, or a physician assistant, just go be seen. Because the amazing truth is, there is absolutely no stage of breast cancer where the medical field cannot help you treat it, or at the very least help you feel better.
So I want to leave you with one final provocative question. If you noticed a physical change today, right now, would you let fear win? Or would you take action and get it checked out? By really understanding the structured breakdown we've gone through today, from the invisible truths all the way to those visible surface changes, you are literally empowering yourself. You have the tools now. Take control of your health with the knowledge you've gained from this explainer. Remember, early action is always, always your greatest ally. Thanks so much for joining me on this one.